Oklahoma children going without.
Most of them are so grateful, that a lot of them, because we have actually saved their lives.
So who's stepping in to help? And what's being done to break the cycle and change Oklahoma's future?
What we want to do is intervene with that youth to help keep them from further law violations, for escalating those crimes and ultimately ending up in prison.
Welcome back to our second half hour of Chronicle. We're looking at issues affecting thousands of Oklahoma children, from food insecurity to homelessness, even access to health care. Thousands of kids in Oklahoma do not have health insurance. It's an alarming trend in our state, and we're looking at just how big of an issue this is. More than 80,000 children in Oklahoma are uninsured, according to the Health Care Authority. That's about 8% of our kids.
It certainly could be better.
David Blatt with Oklahoma Policy Institute.
Oklahoma has among the highest rates of children without health insurance.
Blatt says Oklahoma ranks high for childhood diabetes, asthma, and has low immunization rates.
For children to succeed in school and the workforce, they need to be healthy.
There are several reasons those 80,000 Oklahoma children are uninsured. For some, their families can't afford insurance and they just don't qualify for state help.
Oklahoma, over the last decade, has consistently refused to expand coverage, even though the federal government picks up at a minimum 90% of the cost.
Expanding Medicaid would lower the income threshold, allowing more people to qualify for help.
Because when parents get covered, they're more likely to get their children covered.
But it would still cost the state and taxpayers, something lawmakers so far have said Oklahoma just can't afford.
There is an increasingly vigorous debate on this.
The Oklahoma Health Care Authority says one issue they see is that some people don't know their children qualify for help. And they suggest if there's any question, call their helpline. We're putting that number and a link to the website on ours. Just head to the As Seen On section. And it's not just kids without insurance. Some families are struggling to provide care even with it. We introduce you to one of them.
He has a little Mickey button that goes straight into his tummy, and this tube hooks up to this.
Baby Aaron was born with 4 different heart defects, 1 kidney, and club feet. He has spent 78 days in the hospital. That's most of his young life.
He's a happy guy, for the most part.
His family lives in Guthrie and drives an hour round trip to his doctors.
For his cardiologist and his urologist and his nephrologist and all that stuff, there's nobody closer.
Aaron's parents say he has Sooner Care, but without help from family and friends and Ronald McDonald House Charities OKC, they couldn't afford the bills.
And I made $26 a month too much to qualify.
So we didn't qualify. You would think it would be a lot easier to get your kids covered, but it's
not.
While baby Aaron was in the hospital, the Ronald McDonald House provided the family a place to stay nearby.
Chances are I wouldn't have been able to go every day because we couldn't have afforded the gas by itself.
Now they're home and making every moment count.
Oh, big stretch.
Aaron will need more surgeries in the future, and the family will most likely need help from the Ronald McDonald House again. And even though thousands of Oklahoma kids don't have insurance, there are groups trying to lessen the burden on families. KOCO's Maggie Carlo shows us how Good Shepherd Ministries is helping.
Making sure no Oklahoma child has to go without important medical or dental care. There are thousands of children in Oklahoma who don't qualify for Sooner Care and whose families can't afford insurance. Tonight, an organization that's helping.
We're filling a gap that the state does not fill.
Pam Timmons is the executive director of Good Shepherd Ministries in Oklahoma City.
There are children in the community that fall through the gaps, and so they can just call here and make an appointment, and they're seen by pediatricians or pediatric dental.
From routine medical and dental care to more serious cases.
We've had to reach out to oral surgeons to get their cleft palates repaired.
According to the Oklahoma Health Care Authority, 8% of Oklahoma children don't have health insurance. That's 3% over the national average.
Oklahoma is one of the states that did not expand Medicaid. And that is the reason why our patient population is so high.
Good Shepherd Ministries relies on donations to fund their mission, a mission that in some cases is the difference between life and death.
Most of them are so grateful that a lot of them, because we have actually saved their lives or prevented them from having an early death.
And when you save someone's life,
we actually end up kind of like family to them. They bring us homemade food, they bring us desserts.
Maggie Carlo, KOCO 5 News.
One of the major players in the fight to help Oklahoma's kids, the OU College of Allied Health. They just got a $1.25 million grant. It will help children with disabilities, health professionals who serve them, and the physical and occupational therapists who are just starting out in the field.
Students with disabilities leave the public education system. Most are unemployed, underemployed, and we hear from them that they experience social isolation, which is very concerning because to be a participant socially is connected to health and well-being. This grant is educating entry-level physical therapists and occupational therapists. So we work in the school systems with children that have disabilities to support them to receive education.
This grant will fund the program for 5 years. A bill to help thousands of Oklahomans without health insurance passed a Senate committee in February, but we've passed deadline day at the state capitol, so that bill is no longer allowed to be heard on the Senate floor. It would have expanded insurance coverage for low-income working adults. The Oklahoma Health Care Authority would have created a premium assistance program, and it would have helped Oklahomans making less than 138% of the federal poverty level. If it would have passed, the state would have contributed about $141 million annually. The federal government would have chipped in a little more than $1 billion. The Oklahoma Council of Public Affairs did not support this bill. In a statement, they say our state's Medicaid population and costs have already exploded. It goes on to say this bill would expose Oklahoma to hundreds of millions in new required Oklahoma taxpayer spending annually. We are also committed to helping those in need. Right now on the KOCO app, you'll find a list of resources. Look under the Project Community tab. Many Oklahoma kids also face another problem, homelessness. There's an organization called the J-Rock program. It stands for Jumping from Risk to Opportunity and Connection. KOCO's Alex Housden shows us how they're keeping Oklahoma children out of prison.
J-Rock is a 6-week program that takes youth straight from the detention center, and instead of punishing them more, they use therapy and mentorship to get them on the right track.
If we can make a connection with them, then our services might be better received. If our services are better received, then we're helping to go along on a journey with a youth from risky behavior to healthy behaviors and employment.
Growing up is difficult on its own, but when you add in family problems, substance abuse, mental illness, or homelessness, growing up becomes almost unbearable for some Oklahoma teens. And with Oklahoma jails already overcrowded, Pivot steps in with a J-Rock program to break the pipeline from high school to prison.
So why is this program important here in Oklahoma?
This is really important here in Oklahoma because what we want to do is intervene with that youth to help keep them from further law violations, for escalating those crimes and ultimately ending up in prison.
With their therapy, educational classes, resources, and love for Oklahoma's youth, Pivot has watched hundreds of adolescents come out of their 6-week program with a bright future instead of a dark cell. Alex Housden, KOCO 5 News.
We don't want to just look at the problem tonight. We're also focusing on who's already stepping in to help. Food trucks just for kids who need a meal. We've introduced you to Filling Tummies, the nonprofit packing a school bus with food.
It feels like the ice cream truck, but really it's filled with fresh fruits and vegetables.
Schools are getting in on this too. The Oklahoma City Public School District has their own mobile feeding unit for summer breaks and school interruptions to make sure kids aren't going hungry.
The Pine Pantry services anyone in the community, really anyone driving by that sees our Pine Pantry and has a need. You know, if they're hungry, if they want to grab a snack, if they're, you know, the kids that are getting out of school want to grab something.
Some local communities are fighting hunger through outreach. Just this month, the Village launched the Pine Pantry.
So if anybody wants to donate, it's open anytime, so they can just walk up and put anything that they're wanting to donate.
And the global organization Feed the Children is based in Oklahoma City. We've seen them dispatch their resources right here to make sure our kids are fed. They packed up more than 100,000 meal meal kits during the teacher walkout.
As long as that resource is available, we're going to continue to provide it.
We're in 10 international countries, and we help kids across all of those countries. But a lot of people don't know we've been based right here in Oklahoma City for almost 40 years now, and so Oklahoma is very close to us, and the children of Oklahoma are very special to us. So we are always doing things to try to make sure that those kids right here in our home state are okay. Things like our teacher store, which provides some supplies to classrooms so those kids can get a great education. And then finally something like a summer food and education program, making sure that kids are fed even when school's not in session. You want to make sure that you are feeding kids that need it, and if there are 1 in 4 kids truly in Oklahoma that need food, we want to feed them all. We want to feed kids wherever there's need. So usually they will find us. They will tell their teachers. They will tell their families, and their families will come seeking out help and assistance. But honestly, we want to provide hope and resources for all of Oklahoma.
For fiscal year 2017, Feed the Children distributed more than 91 million pounds of food and essentials in the U.S. and around the world. Oklahoma is the 10th most food insecure state in the country, according to the United Way, and many of those affected are children.
There's nearly 1 in 4 children in Oklahoma experience some sort of food insecurity.
Coming up, the unique places food pantries are popping up and the important role the community plays.